Ready?
Yes.
Good afternoon, everyone. I'm Dr. Kirti Suta. Welcome to Facebook live session from Dr. Makkar's Diabetes and Obesity Center. Is obesity a disease or खाते पीते घर की निशानी? Obviously, yes, obesity is a disease. It is actually a complex disease with accumulation of excessive fat. It is just not a cause of cosmetic concern, but a medical problem that increases the risk of other medical diseases. Obesity has multifactorial origin, including genetic, physiological, environmental, along with diet and physical inactivity. Childhood obesity is also increasing these days. And especially during this COVID period and post-COVID period, we have seen rise in obesity. So today we have Dr. Makkar with us to discuss obesity, a disease. Welcome, sir.
Thank you, Dr. Kirti. Good afternoon, everyone.
So my voice is audible?
Yes, very
I'm a
clear.
little confused. Right, sir. So actually, obesity and overweight is an emerging health problem in India. So today, in this session, we would like to discuss about this disease with you. And first thing I would like to know is why is obesity rising in, I'll talk about our country. Why is obesity rising in India?
Good question. There is, very significant change in the lifestyle over last almost 4 decades. We can say, yeah, starting from 75 or 70, 80 onward, you can say there has been a significant change in the lifestyles. There has been increase in the overall socioeconomic status. There has been a significant increase in the availability of transportation modes. Uh, the automobiles have become comparatively cheaper if you look at the cost of living. Uh, Everybody has access to some or other mechanized mode of transportation. That accessibility has increased. And of course, the availability of high calorie or energy dense foods has increased. So there is basically what we have to understand is that first thing I want the audience to understand is that obesity is not just a cosmetic problem, it is a disease. Second thing is, it is not just that you start eating more and you become obese. It is not just a disease caused by, uh, you know, uh, bad eating behavior or lack of physical activity. You will find around yourself so many people who eat more than you and they are still slim. You will find so many people in your office who just don't, get out of their chair and they are still slim. And you will find people who are very active and still very obese. Now, I can give you some very important, good examples. If you see these, mm, these shows on TV, the talent shows. Look at this lady, Bharti. She's so active on stage, screen, every time. She's still obese. Ganesh, who's a choreographer, he is so obese and he is all the time training people to dance and he is dancing constantly. So it is not just one factor which leads to obesity. So obesity is a disease process where you have some kind of genetic predisposition to become overweight or obese during your lifetime. Now that genetic predisposition is usually set either at the time when you are born, by the time you are born. So it is intrauterine programming. We now know that women who are exposed to undernutrition during pregnancy, their children will become or have higher tendency to become obese. Similarly, people who were born during the famines, subsequently they become obese. So there is a trigger to which leads to expression of genes which tend to, uh, you know, uh, give you weight gain. So there is a strong genetic predisposition which changes according to the environment that you are exposed to, and this interaction between genes and environment actually decides whether you will maintain a normal body weight or you will have a higher body weight or even lower body weight for that matter. And this gene to gene, the interaction between various genes and gene and environment plays a very important role. Your eating behavior is also not largely controlled by your conscious eating. It is also controlled by many factors, which can be your, sensory, smell, sight of food, the mindset. The people who are, having depression will tend to eat more. People who are anxious will tend to eat more. To overcome anxiety, they tend to, drink sugar drink, things like that. So there are a lot of factors which lead to overeating. Also, there are factors which will cut down your physical activity. But nutshell, there is an imbalance between the calorie or energy intake and the energy expenditure. Now, just to make everyone understand that when we say calorie or energy, whatever food we consume goes for two things. One is production of calories or energy, which is required for the various metabolic processes or the physical activity that you do on day-to-day basis. And the second component is protein, which is required for the repair of body tissues on daily basis and maintaining your immune functions. The third part is the fat, which is the largely storage function of storage of calories that occurs as fat. So when you consume excess calories, which are in excess to your daily requirement, there is a chain of metabolic abnormalities which starts and leads to or favors the deposition of fat in body, leading to obesity. So it is interesting thing to know is that I was studying other day the data on overall energy consumption in India. So if you look at the urban population, the overall energy consumption has not increased in last 40 years. But the obesity prevalence has increased by 2 times in last 10 years and by 4 times in last 40 years. But the energy consumption has not increased. The quality of consumption has increased. People are consuming more fat as compared to carbs and low on proteins. Second thing is there has been a dramatic decrease in the physical activity, which is possibly leading to imbalance between the consumption and expenditure. And this environmental change or the behavioral change combined with genetic predisposition in Indian population is leading to increase in obesity prevalence. So we all are prone to obesity because if you look at our background, 40 years back, India was a poor country. People were hardly getting food. Our PM, Mr. Lal Bahadur Shastri, during the famines had given a slogan that everybody should fast at least once a week so that some people will get food to eat. So that was the situation in India. So we were tuned to store, we were kind of programmed to store more calories when we get excess calories. And that is what is happening possibly.
So, sir, can we blame our diet? Can we say our diet is unhealthy, so we are becoming obese?
So diet, see, Bro Kirti, diet, there are a lot of misconceptions. Yes, high energy, diets or the energy dense foods will definitely add to more calories than you need. But what we say as junk food, like pizza here is junk food. But pizza is a normal food in Italy. Pasta here is junk food, but they will be eating pasta as their normal meal. right? So hamburger here will be something like a junk food, but in European countries or in US, that may be their routine food. So, and we have our own junk foods. Like samosa is, it's Indian food, but it is not considered junk food. It is junk food. All kinds of fried patties, tikkis, what you get in market is all junk food. So junk food is basically calorie dense food. Any calorie dense food is unhealthy in a way that it is providing more calories than we require. Second thing is, once you are eating high fat foods, their satiety quotient is low. You tend to feel hungry very soon after your last meal. If you are consuming more protein in your diet, you stay full for a longer period of time, so you tend to consume less calories. So that is why fatty foods usually are not good for the regular this thing, and fat consumption should be reduced.
That means we need to target our food. What we are eating, we should know what we are consuming.
Yes, mindful eating, that is what is mindful eating, or conscious regulation of eating behavior, or understanding the overall calories requirement that you have and make sure that you don't consume more than that. All those things are important in maintaining a good eating behavior.
These days, calories, what the content calorie is written everywhere, it's displayed. So we should read the labels, we should know the portion size, we should know the calories what we are consuming.
Yes, it is important.
So who is at risk of obesity?
Everyone in India. So why I say so? Because 80% of the population in India is moving towards overweight or obesity. We had very low prevalence of obesity till about 30-40 years back. Now if you look at cities, more than 50% of people are either overweight or obese. And this number is growing. And because of this, there is an increasing number of diabetes, heart disease, blood pressure, and so on. So obesity, everybody is at risk because we all are exposed to change in the lifestyle. We all are becoming more sedentary, and we all have higher availability of energy dense foods. All foods that are more tasty are carrying more calories, because it's an old saying that unless you add ghee to anything, it can't be tasty. And if you see the food that you get in restaurants and go out and eat, it is all loaded with fat. Second thing is, the availability of restaurant food at home has become very easy because of Zomatos and Swiggies. Nobody wants to cook. If there is slightest discomfort, you order, you eat, and you finish. And when you are cooking at home, you cook according to the requirement. But when you order, you tend to order, extra food. And that also gets eaten. So there are a lot
And
of factors which have changed over last 2-3 decades, which are adding to this.
so one more change which has been there in the society is that females are working these days and cooking is a big challenge for them. That is an add-on basically. Here comes the role of female in selection of the food. Even if you're ordering from outside, you should have a judicious selection of food.
Yeah, see, so that is what I don't mean is that you can't have good food from outside.
Yes.
If there are Swiggies and Zomatos, there are tiffin walas also who are providing you food. But nobody orders tiffins,
Yes.
right? Unless you are somebody is staying alone and wants to have food every day, they are the people who are ordering tiffin. Otherwise, who is ordering tiffin? Everybody wants to order from a good barbecue or a restaurant. And
Very
even
true.
samosas are getting delivered at home now.
Another very important point is can you be obese and you don't know, you're not aware of it, you're obese?
Yes. So first thing is that acceptance of obesity as a disease is not there. In India, obesity is still not recognized as a disease by the health authorities. Right? It is not. And India, unfortunately, we don't have disease codes where every disease has a code. Obesity is not a disease. Now, of late, it is being recognized as an important healthcare issue, and hopefully, we will get the status of obesity as a disease. In Europe, also, it has been given the status of a disease with a disease code and which needs to be covered by healthcare, right? So, if you look at the Indian healthcare system, the health ministry doesn't have obesity as a priority anywhere. So, obesity has been, conventionally we came from very poor background. We were facing undernutrition. Even now in India, if we have 20% people who are obese, there is another 15 to 20% who are still undernourished and living in poverty. So here bigger challenge is to tackle poverty than to tackle obese. And since people came from very poor backgrounds, so anybody who was physically looking you know, mm, on the normal weight or overweight side was considered to be, as you said, the khate pite ghar ke. So gaining weight was actually considered as a sign of affluence and was related to a good, well settled family or a good income family. So it was a plus point, was considered as a sign of prosperity. It has never been conventionally considered as a disease. Even when we are sitting in clinic and somebody comes with a spouse or child, so they will say ji ye healthy hai. They will never say that ये मोटापा है या obesity issue है, ये थोड़े ज्यादा healthy है. So if you have more weight, you are more healthy. No mother tells that my child is obese. They will say my child is healthy. So basically, the people have started identifying obesity to some extent, but still the concept of using word obese or motapa or they are still not considered very good, and they still would like to describe it as healthy. Actually, the word should be unhealthy. So these things, the perception of overweight has to change. Now, it is not that person does not know person is obese. Most of the people, when they look in mirror, they know their weight is more or less. But some people recognize that as a problem. Some people don't recognize that as a problem. So people who recognize their weight as a challenge, they will usually, try to curtail it. And those are the people who know that they are obese. The other people who don't care about what their weight is, they will never recognize this as a disease or a problem which can be, causing disease at a later date. Dr. Kirti, your signals. I am sorry, there is some interruption in the internet, but I think Dr. Kirti should be joining in a minute only. Should not take time. कनेक्ट करो तुम. हाँ बिल्कुल बिल्कुल करो. Just give us a couple of minutes. I think we should be back here. Yes, Dr. Kirti.
Sir, so sorry.
No
Sorry.
problem. No problem. No problem. Don't worry.
So my next question to you is, can you be obese without looking obese?
So you only said that it is not about looks. So obesity is basically okay. But another important thing to clarify. So obesity is not about weight. Obesity is about the amount of fat that is stored in your body. So if you have excess accumulation of fat in the body, that is what defines obesity. Now, in India, unfortunately, our body structure is such, and our the phenotype or characteristic of our body structure is such that we tend to have more fat at a lower body weight or body mass index. Why we use body mass index as a measure of obesity? Because to measure fat exactly is difficult. You can do it, but you need to do a MRI or you need to do a DEXA scan, which are expensive methods and are not easily available. And you can't tell every obese person to go for a DEXA or MRI to just tell him that yes, you are obese. We have indirect parameters which, by measuring simple height, weight, and making some calculations, or measuring waist circumference, we can decide somebody is obese or not. Now, compared to Western population, we Asian Indians tend to have almost 2 times higher fat in the body for the same body mass index or same body weight as compared to Caucasian population, that is the white population. And if we look at the muscle mass, we have less muscle mass as compared to that population. So on one side we have higher fat, on the other side we have less muscle. So our metabolic profile is bad profile because we are more susceptible to get all these chronic problems related to higher fat content and lower muscle mass content. We have more insulin resistance, blood pressure, diabetes, heart disease, cholesterol, everything. So there are individuals actually who will look normal weight, but the overall fat content in their body is high, and they suffer the all the damages that is caused by excess fat content in a obese individual. Why is obesity important? Because you have excess fat, which is harmful for health, and it is leading to metabolic abnormalities on one side. And if you have excessive weight, it damages your mechanical, system in the body, damages joints, less muscle mass, more fat getting accumulated in muscle, less power to the muscle, and so on. So many things happen. Your lungs are not able to, work appropriately. You get sleep apnea, you get breathing disorders, you get joint problems, reflux, acidity, so many things will happen because of it. So there'll be people who, if you look at the body mass index, may appear normal or are within the normal range. But they have excess body fat, especially the fat in the abdomen or stomach area, which leads to all kinds of metabolic abnormalities and puts them at a higher risk for various diseases that are associated with obesity.
So do we have any tools which we can use to monitor our obesity?
So it's very simple. I think all you need to do is to have a weighing scale at home and just keep checking your weight on regular basis. And if you're gaining weight, you should know that you have to stop somewhere. You have to put a break, increase physical activity, stop, non or excessive eating, get shift to mindful eating, shift to healthy eating habits. And if you can simply keep a track on your waist circumference, you will know whether you are going towards obesity. It is simple. All you need is a inch tape and a weighing scale, and you should know what are the cutoffs. So some simple methods are there to measure what is your BMI. BMI you can actually there are n number of calculators on web internet, or you can just check the formula, put your height and weight, and you will get it. Second thing is you should know what is the normal waist circumference. So for India, normal waist circumference for women is 80 centimeters, and for men is 90 centimeters. Anything upward of this is considered overweight and obese. Now, I'm sure a lot of people listening here will suddenly feel shocked that they didn't know that waist circumference of um, you know, 80 centimeters, which is 32 inches, is going to be obese, or even 90 centimeters for men, which is 34 inches, 36 inches is going to be obesity. So that is how it is important. So all you need to do is measure simple weight uh, and waist circumference and keep a track on it. And you should know whether you are or already in the range which is normal or obese.
Sir, I think I am facing some technical issues today.
No
So,
problem. Carry on. But if there is any issue, I will take over. Don't
yeah,
worry.
right, sir. So, my next question to you is what will happen if you leave your obesity untreated? कि ठीक है, कोई बात नहीं. It's okay.
So there are now n number of studies which have clearly shown that obesity is possibly mother of all important diseases of adult life. There are more than 40 diseases listed under the obesity predisposed diseases. So there is changes in the metabolic parameters on the wrong side. So which leads to increased risk of diabetes, increased risk of blood pressure, increased risk of heart disease, increased risk of strokes, increased risk of kidney disease, increased risk of breathing disorders, sleep apnea, daytime sleepiness, poor mental concentration, depression, joint problems, uh, acidity, reflux disease, fatty liver. So you can keep on counting, and you will find there are so many diseases which are linked. And if you correct body weight, or if you lose weight, you can actually, benefit on all the negative impacts that are caused by obesity. And important thing is, you don't need to come back to normal weight. Even losing 5 to 10% of body weight from where you are, you tend to gain benefit of almost 90%.
So, can obesity be reversed
So,
or
can
cured?
you hear me?
Yes, sir. I think I have connection problem today.
No problem. No problem. It is keep breaking. You can still continue.
So, my next question to you today is can obesity be reversed or can it be cured?
So we cannot say that it can be cured. Cure is not there right now, but reversal, yes. Or you can say remission, because remission means that you have gone back to normal state, but you still can go back to the state where you are. So there is definite answer is yes. You can lose weight, you can come back to normal body weight, and you can get rid of obesity. Now, thing is that mm, we have to understand obesity as a disease like hypertension or blood pressure, like uh, diabetes. So why I am comparing these diseases is that you have to understand that once you lose weight, you don't lose it permanently, and you will gain back if you don't continue with treatment for obesity. As if we treat you for diabetes, we bring down the blood sugars normal. To keep the sugars normal, person has to keep on taking all the medications, has to follow diet, has to follow exercise, keep checking sugar to control diabetes. It is not that once the sugar is normal, you stop the treatment. Same for blood pressure. You start the patient on some medication, salt restricted diet, regular exercise, blood pressure comes down to normal. Person has to continue with the lifestyle changes and medication for rest of life to control blood pressure, and maybe in due course of time need to increase the treatment. So obesity is similarly a chronic disease, and you have to institute what is called long term therapy for obesity management also. So you have to put in long-term lifestyle changes as of now. You have to initiate some medications, and those medications maybe we can stop intermittently in between, but usually need to be continued to sustain weight loss. Otherwise, there is a regain of body weight. And if nothing else is working, if lifestyle interventions and medications are not working, then person should consider bariatric surgery. But one thing should be very clear, that except for the increase in physical activity and the general improvements in diet, like reduction in the fat intake or reduction in the sugar intake, everything else should be done under professional guidance of a physician and a nutritionist. For all the dietary requirements, nutritionist has to be on board. She has to calculate how much protein you should be getting on daily basis, how much calorie deficit should be created, and physician should be there to take you through the journey of weight loss by using various medications that are safe. All medications for weight management need to be monitored on long-term basis, and also to take a call when you need to stop medication or when you need to go for bariatric surgery, or what periodically when you need all the investigations to be repeated to make sure that no complications of obesity are developed. So obesity, one of the things I forgot to mention about complications of obesity is that obesity is also associated with the infertility in both men and women in reproductive age group. Second, obesity is also emerging as one of the very important causes of various types of cancers. So, if you are obese, you have these major problems which can happen. So, it is very important that if you look at the benefits of weight loss, they overweigh, any kind of risk involved or any kind of struggle involved to lose weight.
So, am I audible?
Yes.
So, my last question to you for the day is, so it's good to be fat or skinny?
So, when you say skinny means that it can be underweight. So, underweight, if you are underweight, it is also having its own, issues, and it is more prone to get into different disease states. So, being underweight is also not good. So, you should be actually having a normal, healthy body weight, which is a body mass index between 18 to 23 for Indian population. Your waist circumference should preferably be less than 80 centimeter if you are female, or less than 90 centimeter if you are male. Second important thing is you should be maintaining a regular physical activity on daily basis, preferably. If not daily, at least 5 to 6 days a week, of at least 45 minutes. I don't believe in 30 minutes, because that 30 minutes figure is just to maintain health. But in Indians, we are at a higher risk, so we had a consensus, and we feel that Indians need more exercise and maybe some muscle training on at least 3 days a week, because we have lesser muscle mass also. So we should try to improve our muscle mass. That should be done by every single individual to maintain a good health. That should be the routine for every individual.
So there was a question about intermittent fasting. What's your take on intermittent fasting? Is it helpful in losing weight?
So all kinds of dietary patterns or schedules which lead to deficit in calorie intake will help in losing weight. Now, second, the one of the important things that you have to keep in mind, as I told you, that it is not a short-term therapy that is effective. You lose weight, you stop therapy, you will regain weight. So whatever you plan, you have to plan for long term. So you have to plan exercise for long term. So best exercise is walk. You don't need training, you don't need gym, you don't need a fixed time schedule, you don't need a setup to walk. You can walk anytime, anywhere, and you can do it in split. So walking is the simplest and easiest exercise. No training required, nothing, no investment required. So this is simple. Similarly, you have to maintain a dietary pattern which is lifelong. If you think that you are happy with intermittent fasting for rest of your life, yes, you can continue. It will help you losing weight initially, but the adherence to this is very poor. We should institute a lifestyle and a dietary pattern which is as close or as easily adaptable in a daily routine that it does not disturb any other member in the family. You can't be having a different meal cooked for you in the kitchen every day. So whatever is cooked, everybody should be eating that healthy food. Similarly, one day you are fasting, one day you are not fasting, and second, when you are not fasting, there is also a tendency, yeah, less yesterday I didn't eat, so I can cheat today. So that mindset should not be there. Third thing is, if you are happy with the intermittent fasting, yes, there is data you will lose weight, but long-term adherence, you have to keep in mind that some point of time you will again come back to the normal daily eating. That is a challenge.
So, sir, can I say that obesity does not run in family, but no one runs in the family?
Yeah, those are the kind of posters everywhere now available, and the biggest problem is that we blame somebody, ये ज्यादा खाता है या खाता कैसे है वो, घर में कुछ मिलेगा उसको तभी खाएगा ना. So somewhere the whole system of the household needs to be changed if there is obesity. It is not one individual who is to be blamed. Maybe that individual responds to that food stimulus differently than the other people in the family. So one person is getting obesity. But you have to keep in mind that he is not doing it consciously. If he is overeating, maybe his brain signals are different as compared to the other people. And he is responding differently to food signals or food smell or food taste, or what we call as hedonic eating is the pleasure of eating. You may not like to have pizza, you don't like it, but the other person likes it. So it depends on individual programming. And the most important thing is that you should maintain a healthy lifestyle for everyone in the family, so that everyone becomes a kind of stimulus for other person to maintain a healthy lifestyle.
And so we should readily accept this diagnosis.
You have to identify obesity as a problem. Obesity is, as I always say, is mother of all diseases of adult life. And now with more and more people becoming obese in younger age group, it helps your personal life, your married life, your risk for multiple diseases during adult life. So all these things are pretty bad and need to be avoided.
And especially if we talk about childhood obesity, we have put the entire next generation at the health risk.
Yes, and childhood obesity is largely is largely a result of one is what is mother's behavior during pregnancy. So if mother is undernourished during pregnancy, childhood obesity is higher. Same, is if the mother is overnourished during pregnancy. So if a lady gains more weight during pregnancy or is overweight at the time of pregnancy, the childhood obesity is again high. And people don't understand this. They should actually, if somebody is overweight or obese, the lady should lose weight before planning conception. But they think that they are being overweight will give child more nutrition, child will be healthy. It is other way. The chances of poor health of the child are higher if the lady is obese.
Sir, I'm so sorry today I'm not able to take the questions because of the connection issues. If there are any questions and if possible for you, can you please take it?
Let me check.
As far as I remember, there was a question for targets of type 2 diabetes.
Targets?
For type 2 diabetes, sir. It was the first question of the day.
I don't see any questions. I don't see any questions.
Sir, I will answer them in person.
Okay, so targets for type 2 diabetes means what I understand is you are looking for the glucose targets, and the glucose targets for type 2 diabetes is that your fasting should be less than 120 and your post meal sugar levels should be less than 150 to 160 all the time, and your A1C should be less than 7%, preferably 6.5% if can be achieved without causing hypoglycemia. Those are the usual targets for obesity or for type 2 diabetes. So, Kirti, I'm not able to see any questions here. I don't think there are any.
So we can then end the session.
Just give me a second. Yeah. No, there are some questions. What are the steps to be taken to reduce childhood obesity? So the most important question issue here is that if you have a child who is obese, the family needs to change its behavior. Childhood obesity, there is a predisposition in child to become overweight or obese, but the problem is that something is wrong with the family's culture or the environment at home that is predisposing this child to eat more and be physically less active. If parents are physically active, they are eating healthy food, they are not allowing child to they are not getting all kinds of these sodas and cokes at home in plenty, they are not ordering food every second day from home outside, the child will eat what child is getting at home. So if you have to focus on childhood obesity and try to bring it down, first thing is you have to focus on the parents and the family behavior. That is the most important way to reduce childhood obesity. Second thing is during pregnancy, before pregnancy, if somebody is overweight, should lose weight. Third thing is during pregnancy, you should be eating normal food, healthy food, and also um, be regular with physical activity. So all these things are important. Yeah, another question is it always important to see a dietitian or physician to know any diet changes that are needed, or should one? So I told you, the one's own adjustments can be simply on reduction on fat and sugars. But if you generally reduce the total intake of food, you tend to reduce minerals, vitamins, proteins, and everything, and that should not happen. Otherwise you will get into some kind of deficiency, so it's always better to consult a dietitian or a physician to go about changes in diet. Second thing is you have to keep in mind that diet alone is not going to lose weight, or if you are just dieting to lose weight, you are likely to lose more muscle mass as compared to fat mass. So any weight loss plan should be a supervised, medically supervised, integrated weight management program where there is a dietitian involved, there is a physician involved. You should be regularly, testing your blood parameters. If anything is going wrong, you should be under regular monitoring for your blood pressure, sugar, everything. So it is not to be done, just on guesswork. So it is any weight management program actually should be properly supervised, medically managed weight management program. There is another question, sir. During lockdown these days, I mean, how to keep a check on kids' diet as it is important, no major activities as such. So I think now things have changed much better, but you can always create activities at home. That is what we did for our patients. So we told them that you can't go out, fine, you can download some dance videos, start taking dance classes on Zoom. People were doing that, and you can increase your physical activity at home. You can try to work out eating patterns which are good. If you are getting more fruits at home and feeding children with more fruits, you are not ordering fruit from outside, then child will also have good food. It depends on what you are eating, not what your child is going to eat. So if you have good healthy behavior at home, everybody is going to benefit. So I think I have covered mostly. mostly all the questions that I can see here we have covered. Hopefully we have done justice to this session, and in any case we keep on coming back with the same topics again also, because there is no single topic that we can finish it in one time and take care of every single question that will arise in the minds of people. So we are always open, and you can keep sending us questions, and they also give us idea that what should be our next topic. Hope you enjoyed this session, and hope you will also join our further sessions, which happen on every Thursday, 3 p.m. And hope you find our sessions useful. Uh, Thank you very much, and see you again. And thank you, Dr. Kirti.
Sir, sorry, so sorry,
No
everyone.
problem. You don't need to be sorry. It is, I think, some internet provider should be sorry. Thank you very much. Thank you, everyone.
Thank you.